Hello, everybody. Welcome to the Community Engagement, Education, and Outreach Onboarding Training. If you have taken this training previously, welcome back. You're welcome to stay for the entire segment. If this is your first time, buckle up. We will be beginning shortly. Today's session has closed captioning available, so click on the chat box and open up a new window with closed captioning. We have a couple of housekeeping rules with our Zoom request today. So again, like I just said, if you've already attended this meeting, welcome back. You're welcome to stay for the duration of this training. If not, if you just want to review certain segments of it, feel free to do so. Another thing is we love your faces. And so while many of you may have just your name appearing, we'd love to see you on camera. So please, as much as possible, share your faces. We know that you have pajamas on from the waist down. That's okay. Just don't pan down. We'd love to see your faces. Let's also check your mute button whenever possible, because we don't want any distractions. We want to be able to go throughout this whole training in a way in which everyone gets to hear. Please feel free to use your chat, hand raise, and clapping features. Let's all remember today that we're here to learn together and to engage. We will, as co-hosts, learn as much as you do. So let's make sure that we participate in this process. Because we have so many people participating in today's training, we will ask that you hold your questions until the very end. Let me introduce myself. My name is Larry Hill. I'm one of your co-hosts for today. I use pronouns he, him, and his. I am a community engagement coordinator. I am in Region 1. I have Clackamas, Multnomah, and Washington counties. I also have faith-based organizations and statewide organizations. I will let my co-hosts introduce themselves.
Good morning, everybody. My name is Vanessa Cardona. I go by the she and her pronouns. I'm also one of your co-hosts for today, and I have the pleasure of working with grantees in Region 3, which is Coos and Curry counties, as well as Region 5, Jackson and Josephine counties, and I also have some statewide grantees that I work with. Welcome.
Good morning, everyone. My name is Josilia Johnson. I use she, her pronouns. I'm the Community Engagement Coordinator for Region 1. I represent Clackamas, Multnomah, and Washington counties. I also work with community-based organizations and faith-based organizations in those counties as well. Good morning.
Okay, welcome back. So now that you know a little bit about us, now we'd like to know a little bit about who's joining us as a part of today's training. So using your chat box, we would like you to share your organization name and your county. Your name will automatically be registered. Let's take about 3 minutes to do so. And as you're doing so, we will have Josilia kind of share some of the names or maybe some of the organizations that are participating in today's training.
All right, good morning. We have the Boys and Girls Club of Portland. We have Douglas County in the house. We have Utopia PDX, Lane County HIV Alliance, Oasis of Praise. Good morning. We have Giving Tree in Multnomah County. We have Washington counties in the house, the Next Door Incorporation, Hood River and Wasco counties. Good morning. We have Doulas Latinas in the house. Benson County and Lynn County is in the house. Good morning. We have the, oh wow, this is moving really fast and I'm so excited to introduce everyone. I'll try to get to as many as I can. St. John's All Nations Church, God in Christ. We have Eastern Oregon Independent Living in Pendleton, Oregon. We have Klamath County and Josephine, Jackson counties in the house. Oh, wow. We have so many people in the house and we're just so excited to see. Let me see if I can do some more shout outs. Next Door in Hood River. We have the Asian Health and Service Center. Good morning to everyone. If I didn't get to you, still good morning. Thank you for being here. We really appreciate you spending your morning with us. And thank you. Thank you all for being here.
All right, so let's review today's agenda. We will have team introductions and the regions that are covered. We will define common terms and we'll invite you to share terms that you all utilize on a daily basis. We'll talk about the context of work and who it serves. We will look at the scope of work. We will review educational resources, and there will be a participatory exercise. And so there will be a breakout activity in small groups, which we will share later. We will go through a process of how to request materials and also talk about the use of logos. I'm sure you're interested in that. We'll discuss materials approval process. We will review reporting activities, and we'll talk about that critical association with our local public health authority and the coordination of effort, and also what role we play as CECs. And then again, we want to hold all questions until the very end.
We're going to begin our presentation with some acknowledgements to the community. We acknowledge there are institutional, systemic, and structural barriers that perpetuate inequity that have silenced the voices of communities over time. We are committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues, so that groups can actively participate in planning, implementing, and evaluating efforts to address the COVID-19 response and other health issues. We recognize community-engaged health improvement is a long-term and adapting process. We are striving to engage with communities through deliberate, structured, emerging, and best practice processes. We are striving to make engagement with public health effective for communities, especially those communities that experience institutional, systemic, and structural barriers.
Meet our team. This is the group of community engagement coordinators that are delighted to work with you all. Our bold and fearless leader is Dolly England. She is the community engagement program manager for this grant. We are 10 community engagement coordinators deep and in the process of onboarding 2 more to support all the great organizations that are a part of this work. This is a preparedness map of the preparedness regions in Oregon. And while most of us are divided by region, some CECs serve statewide organizations as well. We also have 2 CECs that specialize. Danny Galvez, she supports all Asian and Pacific Islander community organizations. And Sharina Walker works with all disability-related statewide organizations. So what does this mean? In this grant, we tend to love our acronyms, and this grant comes with a lot of them. So just so that we're on the same page here, we'll just go over some of the more common acronyms that you'll hear throughout your grant and probably from your CEC. CBO, community-based organization. You may also hear FBO for faith-based organization. CEC, that's us, your community engagement coordinators. Your SOW, scope of work. CEEO, community engagement, education, and outreach. And LPHA, that's your local public health authorities. And of course, OHA, Oregon Health Authority.
We also invite you to use the chat box for some of the acronyms of organization or other resources that you use on a regular basis. This will be a way of you sharing so that we broaden our scope of what we understand and what we know about what's happening across this state. So why are we here? So early on in this pandemic, we got feedback from communities about COVID. There was discussion among our communities that information was not getting out consistently, that information wasn't language appropriate, that messaging to marginalized communities did not address their specific needs. So Oregon Health Authority quickly recognized that we were not equipped to do the work within communities in a way that was adequate. We could not communicate to our populations in the proper manner. As such, we decided to invest $25 million of CARE Act funding directly to community-based organizations. So in that regard, you specifically have been chosen because you have a specialized ability to reach segments of our community that aren't consistently targeted by other health agencies. Again, marginalized communities have been more impacted by COVID-19. CBOs play a critical role. And as experts of your communities, you have a finger on the pulse of your very communities. You know what your community needs. You have entrusted relationships. And as such, this is why you're here today. Who does this funding serve? When we think about who this money is supposed to serve, first and foremost, it's for persons who have been adversely impacted by COVID. So for sick people, this is what this funding is for. When we think about that, we think those who have disproportionately been adversely impacted in our state. When we think about Black, Indigenous, and people of color, we think about people with disabilities, we think about families, people who are houseless. We think about individuals with substance use disorder. We think about immigrant and refugee communities. We also think about those within faith communities, undocumented communities, farm workers, people experiencing mental health issues, older adults, LGBTQIA+ communities. Again, all segments of our community are impacted. These funding serve those communities, and you play a critical role in addressing those very communities. So when we think about this work, we recognize that we have to implement trauma-informed care because no one is immune from trauma. Trauma comes in various forms and is influenced by an environment, behaviors, and circumstances. People who have been traumatized often need support and they need understanding. Being trauma-informed allows us to meet people where they're at.
Now we'd like to talk a little bit with you all about the Community Engagement, Education, and Outreach Scope of Work, or SO. So what the SO does is basically it outlines work or deliverables in a grant agreement that the grantees are responsible for completing. So what we've done is we've teased out these 4 tasks from the grant application and the grant agreement in regards to community engagement, education, and outreach. And we want to make sure that we go over them with you and that everybody's on the same page and has a good understanding of what is expected. So the first one here talks about regular communication with your communities in their preferred language and different formats. And by formats, we mean just different ways that you're giving out the information. So that could be print materials, it could be audio, it could be social media, any kind of way that you are getting information out to all your community members. The second the second point here is prevention messages for safe practices. So this includes how to avoid getting COVID-19 and what people can do to be safe. The third statement here is be a resource for testing, for healthcare, and social services. So we tend to think for the SO, for community engagement, education, and outreach, to just be prevention. But as we can see here, it's also knowing where to turn when people ask you for where can they go to get tested, for other social services, or any kind of issues related to healthcare. Maybe they're not insured and they need to sign up. So that's part of this scope of work, is knowing what those resources are in your community. And doing this actually in coordination with this last point, local public health authority, right? So when we coordinate with local public health authority, we're working with them to understand where these testing sites are, how the LPHAs fit into accessing healthcare and providing other social services. And I will say that every community engagement coordinator has a role in linking all the grantees for this COVID response work to their local public health authority. So if that is something that hasn't happened just yet, just hold tight. That's on the next kind of our next phase after everybody is onboarded and funded. So let's take a pause as we reflect on what I just reviewed with the scope of work, and I'd like to pose a couple questions that have a direct influence on how you engage with your communities and provide education and outreach. The first question is, where do people get their information? Where is it that people trust to give them information? If you could please share your response in the chat. And Josilia will help us to monitor what is being said. Thank you.
Yes, I'm seeing online news and social media, friends and family, church leaders, a lot of friends and family, right? OHA, websites, doctors, newspapers, CBOs, more friends, TV, radio, elders, talk about flyers being posted in buildings and social media, websites of trusted agencies, community health workers, one-on-one conversations that you're having with people in the community. Facebook, PSAs and billboards, political leaders, school districts, co-workers, events that might go on in the community, just from being around the neighborhood, maybe conversations that you're having with people that you see and meet. So a lot of people, a lot of different places where people get information, and so what's really special about working with organizations like yours is that, you know, people trust you, people in the community trust you with their information, with the just with them. And so you guys are in a unique role to provide, to demystify some of this information about COVID and to educate in sensational ways.
Thank you, Josilia. All the responses also hint at maybe possible partners that you may want to loop into your outreach plan so it could be most effective. Let's move on to our next question. What information about COVID-19 would you like to share with your community? What are you hearing already in your community that is a need? Please share your responses in the chat, and Larry will try his best to keep up with all of them.
People who, okay, what we have here is people who knows families' culture and language. Okay, how to get tested. We need an easy reference list for this. Okay, testing availability. Again, testing being the prevailing theme. Wear your mask, standardized protocols, and consistent messaging that is culturally agile. I love that. Face covering. Affected people are not informed of support resources. Yes. Prevention, acknowledgement, or acknowledge isolation and support, how to stay safe and resources, mask compliance in apartment lobbies, in elevators, in congregate housing. Very good. Accurate and specific information on how to get the help they're looking for. Have a location that they can regularly go to for this information. Mental health resources. Very clear signs and symptoms. People are afraid or concerned that went too fast. Support available for folks who have quarantine. Again, many families are paycheck to paycheck and cannot wait weeks for unemployment. Yes, this is all very good, and we have resources and information for that. Be empathetic and respect and share information, testing for uninsured and underinsured, how to still creatively connect with friends and family safely and not feel so isolated and alone. Extremely good sharing in the chat box.
Wow, you all shared many great ideas about information you would like to share with your community. I heard a lot of great things, particularly mental health during these trying times, like being able to have resources to be able to talk to people and to be able to provide that support is so key. Also heard looking for resources on testing and isolation and quarantine. So we're happy to share a lot of these resources, some of which we'll go over today. And the resources that we share, of course, are not exhaustive, but we're hoping that it'll at least get you started to reach those goals, those communication goals that you might have. I also want to preface this with we're highlighting some of the state and national resources, and we definitely encourage you to explore your local public health authority resources and web pages for more tailored messaging for your area. Lastly, everything that we'll cover, all the links will be available to you after the presentation. Now let's get into these resources. Okay, so we'll begin with the OHA COVID-19 website. If you're on Google, the quickest way to get to it is just do a search for OHA COVID-19. Okay, navigating the OHA COVID-19 webpage can be a little bit daunting if you're unsure of what you're looking for. So allow me to walk us through the actual webpage and show you where to look for resources. Vanessa, I'll take us there now. Thanks. All right, so everybody should see the OHA COVID-19 webpage. And so what we'll do is we'll just start at the top. All right. So in this light blue box, these are like the hot topics. You see mask requirements, testing, contact tracing, and reopening criteria. This is a good place to start if you're just looking for some quick facts on, okay, what are the latest mask requirements? How young do kids have to be to wear a mask? Like those types of things, you're going to find them here. We have all of these pages are in English and in Spanish, but the resources on those pages are in multiple languages. When I navigate us to the contact tracing page, I'll show you what I mean. So if you're on our webpage, you can just scroll on down. In the yellow box, we have some of the more critical information that's happening now, so a lot of information about school health and safety. I want to take us to the frequently asked questions. Now, if you visit this page, you can literally search for a topic and it'll pop up. There are a lot of questions that have been asked, a lot of questions that have been submitted, and so we curate all those questions and we have them here, and this frequently asked questions is updated quite regularly. I want to just show you that this is the Safe and Strong campaign. We'll talk about this a little bit more later on in the presentation, but I just wanted to show you where it lives on the OHA webpage. Okay, we'll continue to scroll down. We'll scroll down past the data reports, and we'll get into, sorry if I'm scrolling too fast and making you seasick. We'll get into some of these community resources. So you'll see two things I want to point out: the community resources for specific groups, and also community resources by topic. So I will navigate us to one of these just so you can see what lives there. So if we scroll under the People with Disabilities tab, you'll see that, we have videos here. We have guidance documents, and you can see that they're available in many different languages. We have resources for families of children and youth with special needs, and also communication cards. We have links to external partners and information in ASL and videos down below. So I encourage you to explore these areas, the community resources by groups or by topics, to find some targeted messaging for your organization. Next, I'm going to take us to the contact tracing webpage. All right. So you should see a cute little cell phone at the top. And this is our contact tracing webpage. It is available in English and in Spanish. The whole page translates. And even if you are an organization that hasn't been awarded for contact tracing, I think you'll find the information on this contact tracing webpage really useful to talk with people in your community about the different aspects of contact tracing, whether it be isolation and quarantine. What's the difference? If someone contacts you for contact tracing, what does that call sound like? What kind of information will be asked? Why does it matter? So on this page, this was designed to be for the public to kind of demystify contact tracing. So you'll see just different information about how your privacy is protected, what questions will be asked, what won't be asked, because that's really critical as well, and what to expect when you answer the call. If we scroll down to the very bottom, this is an important distinction too. If you have a COVID test, a positive COVID test, versus if you've been near somebody with COVID, and these two columns kind of take you through what the difference is, between self-isolation and quarantine. At the bottom, you'll see downloadable resources, and we have these resources in many languages. I'll pop this up so you can see the languages that it's available in. And these flyers, someone asked about how to quarantine and what does that mean. So these flyers can be shared through social media, they can be emailed, but also if you are doing some hand-to-hand, face-to-face outreach, we can send some of these materials to your home. So we'll get into that a little bit more later on how to request documents, but I just wanted to show you what type of documents were available, what type of flyers and resources are available. So I encourage you to check this out after the presentation. Okay, I'm gonna stop share so we can go back into the presentation. Thank you, Vanessa. All right, so you've seen a lot of the different resources, and what I've shared only scratches the surface. We have so many different resources available to you, and we'll definitely share links on how to get to those materials. This is sharing anything on social media, sharing any social media cards or flyers is all counts towards your outreach and engagement numbers. So just remember that when you're sharing a post or you're sending a message. We also offer everything in a variety of languages, and we continue to add more. So if you see a resource and you would like it in a language that we don't offer, please connect with your CEC so that we can make sure that we have those resources available to you in the language that you need. Our goal is to build a library of resources that work for our community and meet the cultural needs of our community, which brings us to transcreation. If transcreation is a new term to you, in a nutshell, transcreation is pretty much like the art of transferring the essence, tone, mood, and intent of words from one language to another. It's ensuring that the feeling and true meaning of the words is transferred into that new language. Sometimes direct translations can miss the mark on this. And so that's why transcreation exists. It's to be able to tailor the messages, take the words, and actually have the meaning transfer over. And so some of the materials that you see, you may see opportunities for transcreation. Again, reach out to us so that we can make those resources available. Next, the OHA health talking points is another one of those like hot topic. It has the most current updates about the coronavirus. It's actually used by 211. This is their one of their main resources. It comes out every Tuesday and Friday. It is constantly updated, and because it's kind of like a beast of a resource, the updates are clearly highlighted, so you know where to look. This is available via listserv, so we'll enclose the link if you would like to sign up to receive this, and we'll have that resource available to you if you'd like to sign up. Next, we'll discuss the Safe and Strong campaign. This campaign is brought to us by Brink Communications. Many of you might have heard of this, and if you haven't, if you're new, this resource came about because many community members and community-based organizations were outspoken and let us know that we weren't meeting the cultural and language needs of every Oregonian, particularly people who have been disproportionately affected by COVID. So this campaign was designed to be a culturally responsive and trauma-informed COVID-19 response campaign. And it's designed to connect communities with information and resources that they can actually use. So one thing that they've created is the Safe and Strong Technical Assistance Playbook. This has been available on their website since April, and it has a whole bunch of things that we'll show you in just a moment. But one thing I want to touch on while we're here is that Brink is going to be doing a new phase of this Safe and Strong campaign centered around you all, centered around all the organizations that are a part of this grant. And what they'll do is they'll ask you about your communication needs. So if you're interested in increasing outreach, they'll help you with that. If you're interested, if if you're like, we do a lot of Facebook, but we would love to get into maybe doing PSAs or radio. They'll help you with that. They just really know the power that organizations have in influencing the community, and so they really are going to be asking you, like, what is it that like you dream of in terms of your communication needs, and they'll help partner you with resources and help create materials, whether that's web or print materials, to help you reach those goals. So your CECs will be reaching out to you with an invitation to almost like a invitation party that Brink is throwing virtually, of course, to share this news with you. Okay, so this is what their website looks like, the Safe and Strong website. And we'll hop over to their website now, and I'll show you some of the cool things that they have on there already. Okay, so this is the Safe and Strong website. You can you can translate their website into many different languages. So I just kind of want to point that out from the jump. I will try not to scroll too fast. So they have a bunch of resources here. They have resources pertaining to safety net, community support, many different languages, and if you see a language gap, please let them know when they do the kickoff campaign so that they can try to meet those needs as well. They post the latest updates, and if you keep scrolling, we can navigate the technical assistance playbook. Again, links to all of these will be available at the end of the presentation. So what's great about Brink is that they have tailored all the messaging and made it so that it's easy, digestible information. They have talking points for communities if you're going to be speaking to a group or doing outreach. They have public service announcement scripts that you can take that's already been vetted, and you can just kind of add your own like flair to it, but those are already created. They even have audio samples that you can use to amplify messaging in your community, and campaign ads. And at the very bottom, they have a way for you to download and share the Safe and Strong campaign social media cards in your community. And so if you have, once you have more time to play around on this website, you can kind of see the types of resources that they have and the types of resources that they create, and they can help you create, and just kind of get an idea of the type of things that they have to offer. Okay, I'll stop share and you can head back to the presentation.
Thank you, Joselia. So I'm going to take it from here and share a couple of more resources before we move into our small breakout groups. So the next resource I wanted to share with you all is TV Jam by Viva Northwest. For those of you that are not familiar with Viva Northwest, they're an organization that focuses on exposing people to the great outdoors or to nature, and for people who didn't kind of grow up with this experience or exposure. And they have a program called TV Jam. And TV Jam is essentially all these audio files that any grantee or CBO could use to put out messages or conduct education and outreach. And all these videos are Oregon Health Authority approved, as well as OHP, Oregon Health Plan approved. I've listed a little bit of some of the types of videos here in the bullets, in the open bullets. We have myths and truths about COVID-19, outdoor activities and COVID-19, pets and COVID-19, as well as many, many, many prevention messages. All of these videos are free and available to all of you. They come in 26 different languages. Some of the languages fall outside of the standard languages that OHA actually translates. So we have, they provide videos in Thai, Nepalese, Tongan, Somali, Arabic, French, Burmese, even some indigenous languages like Mam, which is an indigenous language of Guatemala. And a lot of this work and the creation of these videos was actually kind of speaking to some of the points that Larry was making early on in our presentation about Oregon Health Authority realizing very quickly that it didn't have the specialization to provide materials and information to every single community that makes up Oregon. And so this project was created to be able to do that more effectively, and is really language equity driven to make sure that everybody has access to these materials in a timely fashion. To get access to these videos, because they all live on a Google Drive, you would email this staff member here. Her name is Karina Cocochea. And you would just email her and ask her for access to the TV Jam videos. Another way that you could have access to the TV Jam videos is if you go directly to YouTube and you do a search for TV Jam, and that all should populate for you. Another resource we'd like to share is the OHA Facebook en Español Facebook page. This is a big deal because OHA has never had a non-English social media platform. And so since the beginning and the creation of this platform for Spanish-speaking communities, they've had a huge following in the short time that it's been created. And this is just an example of how for this particular community, Spanish-speaking community, Facebook happens to be an effective platform for communications. So if you serve the Latinx population, please send them a friend request and share posts that they put out, because that counts as education and outreach for you as a grantee in this coronavirus response work. And so here's the name of their Facebook page, at OHA Español. We also wanted to share, we've been focusing a lot on the physical health, but we also want to acknowledge that mental health is equally as important. And COVID is actually making this a difficult time and affecting a lot of people's mental health, especially as this pandemic continues to be an issue and we can't resume to our normal lives. I think all of you can resonate with the fact that this emotional and pandemic fatigue is very real. So what we've done on this slide is pretty much just highlighted some resources that pertain more to the mental health of people in different communities. So up at the top, we have a Latinx mental health group on Facebook. You can find them at Charlas Comunitarias, and that just basically means like community chats in Spanish. And this is a group that meets every Tuesdays and Thursdays, and it's kind of like a live stream Facebook event that you can promote or join. We also have the National Alliance on Mental Illness, or NAMI, is their acronym, and they have on their website a lot of mental health resources for Black, Indigenous people of color. And then lastly, we have some resources that are mental health related, geared towards the Hmong, Black, Latinx, and Somali communities. And these were put together by the Twin Cities Public Television, Minnesota Department of Health, and WellShare International. So as Joselia mentioned, at the end of the presentation, when you get this email to you, we'll have about 3 slides that'll have in the order of the presentation, all the live links that you can go and click on. But we just didn't want to put it here right now because it wouldn't work if you tried to go and click it from the presentation.
Okay, we've now come to this segment of our presentation where you get to play a role, get to participate with some of your colleagues. So we want you all to tell us about a successful example of community engagement, outreach, and education for the population your agency serves. So we want to think about some of the things that you've done previously at your CBO with the populations that you serve in a targeted way. And in doing that, we want to frame that and think about how you can take those lessons learned from those experiences and apply them to COVID community engagement activity that you're now about to implement or are currently implementing. So take what's been learned from the past and talk about how it's being implemented in some of the COVID work that you're currently doing. We're going to take about 15 minutes to do so. We're going to break you up into rooms. You're going to have about 15 minutes to talk about that. Again, talk about the successful examples that each of you have had in your targeted communities. And if you have a different community than other CBOs, talk about that. Say, for instance, in this community, here's some of the methods that work. At first, we were having some difficulties, but we found when we engaged in this manner, utilized these platforms and came with different times and utilized these different types of, say, community health workers, we were able to get such and the, whatever the case may be. Okay, so Vanessa, are you willing, or do you have the abilities to break people out?
Yes, I believe I do. So let me just give me one moment while I work that out.
And I'll drop the discussion questions in the chat box. So the chat box will follow you when you're in your breakout rooms, so you can reference the questions when you're having your discussion.
Thank you, Joselia. Okay, I'm about to hit create breakout room. So if you'll have a little window that pops up and then you just join that way. Okay, here we go.
See you back in 15 minutes. To this presentation.
Absolutely. Thank you, Larry.
Okay, folks, we're gathered back. You were together with many of your colleagues for some time, and so we would ask that you unmute yourself and share some of your learnings from your small group discussions. We will try to monitor you as best we can from our vantage point. If you can either raise your little blue hand or just wave your hand, we'll accept questions. So did I see, say, don't wave because I'll pull you out. So if I'm pronouncing your name correctly, Ekram, did you have a question? I'm trying to unmute you. Oh, and it's not working. Okay, so.
No, I just said hi.
Okay, well, we accept your hi and your beautiful smile. And if a question should come up, please please feel free to share that. So
Okay.
others, I'm sure there was some great, rich conversations among you in terms of what you all have done in the past. And then furthermore, what you're doing currently that is being applied to this COVID work. Any sharings that groups want to, or individuals want to share based on your discussions?
Your hand, Larry.
Oh,
Amanda?
okay. There we go.
I can share something. So with my group, I was just telling them as the Asian community, we've been doing like a lot of outreach calls. Like we've been doing food packagings for them. We're also doing like a lot for newsletters as well to mail out to them as well, kind of thing. But yeah, it's like for the most part, we try to engage as much as possible with them without seeing them in person. Usually we do have clients that calls in a lot to us, and sometimes like if we don't know it ourselves, we kind of refer it out to them to a 211 or to the county to make sure that we're not giving like false information kind of thing. But yeah, so we've been doing a lot of outreach calls to make sure, and because like our center, we usually do like weekly groups with our seniors. So we do still keep in contact with them to make sure that they're okay or they have any questions they have for us, kind of thing. But yeah, for outreach right now, we're just doing a lot of newsletters and other sources that they might need from us as well. So yeah.
Thank you for sharing.
Yeah.
Hi, can I tag into that?
Absolutely.
This is Gloria Lee from the Giving Tree. We have a partnership with the Asian Health and Service Center for downtown Portland that we're doing culturally specific Asian food pantry deliveries once a month. So because we can get some food that is culturally specific to the Asian population, it makes them extremely happy and excited. And we're using first language, whether that be Mandarin or Cantonese or Korean, volunteers to deliver. So it's also a little bit of a removal of isolation. And it's been working out really well. We've started a GoFundMe for to supplement ingredients that are not available from the Oregon Food Bank. And then we've had an opportunity to add free masks and also proper mask wearing in Chinese and Korean languages. So it's been, we're serving about 150 households and growing every month through about 6 affordable housing properties in downtown. It's been great. And I do have a question, so I can wait for that.
Wonderful. We love the fact that you are normalizing the messaging about COVID, that you are kind of embracing the whole ideals about safety measures and in terms of mask and maybe promotion of social distancing. Again, we're using different platforms and different methods to get people to understand about this. So thank you so much, Gloria, for your sharings. Others?
Yeah.
Alex.
Yeah, hi, my name is Alex Jumikinga, and I work for the Olala Center in Lincoln County. And I was telling my group that I work with a lot of the indigenous Guatemalan populations here. And what it's really been great about this, outreach, it's that we are providing our community with services in their own languages now. Mm-hmm. And that's a great resource that Vive Northwest and, in partnership with Deutsche created for, for our communities. I know there was a huge gap of communication, and I've been, working with this population for about, 4 years now. So I was always kind of advocating for that part. And I think our voices was, finally were heard. And thank you for that. And our outreach it's been good. And we have so many people that are working together to help the population here. And I think that as we see in the future, we see that, great things are coming for our communities. And we like to use a lot of visuals because that's the easiest way to spread the message, and we notice that it's making a huge difference. And my hope it's just to continue doing that in for the future. Thank you for all the support that you guys are offering to our communities. We're really grateful.
Actually, we thank you. Again, you all are the experts. You're the ones with the finger on the pulse of the community, and we appreciate the work that you do on an everyday basis.
Yeah, Larry, Pastor Mark
yes,
here.
Please share, Mark.
Yeah, thank you for the opportunity representing Oasis of Praise in partnership with iLeap and Last Call Ministry. We hosted actually the first community-hosted COVID testing event in partnership with OHA back on the 15th of August. We tested 155 people, and we gave out 500 food boxes to families, coupled with giving out material regarding COVID-19. So it was a good kickoff in 100-degree weather.
I remember the
lots
day.
of water, but it was just a remarkable event, and it was just good seeing our BIPOC community coming out, because we understand the historic distrust with the health industry with our people, and to have them, trust these relationships that we forged over the years to come out and be tested was a rewarding thing.
Yes, absolutely. And I remember the day, and the ramifications of such a setting kind of reverberated throughout the community, because again, it's normalizing the messaging, the importance of this issue. And again, trust me, the next day we heard about it throughout the community, within agencies and throughout. And so we applaud those efforts, and please continue. We're going to take a couple more before we move on with the presentation. So any other gleanings that others would like to share? Do we have
what I learned from my group was that in a sense it's because basically we're still we kind of agree that we're still doing the same kind of help or reaching out to the community that we used to do before. And in some sense it's even better today because there's more resources collaborating, to one person to share to more people in the community. And then also the same as the boss, like you guys, you have more um, um, you're collaborating more with like the head of the boss of the nonprofit organization and sharing more ideas. So our help with the community before, it's almost the same as today, it's just done differently. And then I also mentioned um, like I do a lot of community outreach to people, and I'm an islander, and I come from a very relational culture. And the only difference today is that, we're not physically engaging. We're talking on the phone, we're being on the Zoom, yet we're still doing the kind of help, but not physically anymore, that's just kind of like the difference. And then another good thing about one positive thing I also mentioned, the difference from helping before and today is before we were just um, given resources from the government to give it to the to the community. Whatever the government has to offer, we just get it from them and give it to the community. Where today is a little bit different. It's like the government is allowing us to give to the people more of what fits them. Like, because I'm an islander, I don't eat pork and beans. today, like the resources allow me to eat the type of food that I choose, as who I am. So it's like I said, it's still the same thing. We're still doing the same like we did before. It's just a little bit different today because, it's the social distancing.
Thank you so much, Roger. I liken your story to the one that Gloria shared earlier in terms of adapting, providing the essential cultural spin on what needs to be done to really appropriate the populations that you're serving. And again, we all have to play a role in this process. Certainly CBOs play a huge chunk. Local health departments play a chunk. We as CECs, we're here to kind of assist, kind of like pull the two groups together. But again, we're doing very intentional work. We love the fact that you all are on the ground doing the work, and we're here to support you whenever we can. We're going to listen to Pastor Pascal, one last one, and then we're going to move on with the rest of the presentation. Good Pastor, please share.
Good morning, Larry. Good morning, everybody. It's just a quick question. As we're trying to reach out to African community, my question is, how is our limitation, or how far can we go to try to reach these community people? I know that all these refugees, they are scattered everywhere, from Oregon to Washington and in other states. And I'm pretty much sure they do not have the information that we have. So in this program, will I be allowed, or am I be able to reach out somebody in the state of Washington to do this program, or it's just something limited into Oregon? Yeah, that was my question.
Okay, we appreciate that. And one of the reasons that we have 180 CBOs who are doing this work is because we've identified many agencies that really are scattered throughout, who are specializing in different groups, different populations. And so I invite you to call me maybe offline so we can identify maybe the groups you're looking at. We have a number of agencies that are specifically targeting different African immigrant populations and doing work specifically with them. And so we certainly, if there are some who we're not actually addressing, I'd love to hear some conversation about that. We, again, are trying to get anyone out there who, again, may be at risk of contracting and transmitting COVID to others. And so certainly we want to make sure we address all the needs of everyone. So please, I invite you to talk with me offline. But we have a number of agencies that are filtered throughout the state who are addressing the needs of those populations.
Okay, thank you very much.
Thank you. Okay, we're going to move to the next segment. Thank you so much for.
Larry,
yes,
Roger. Can I just say a little bit? I think one of the great positive of reaching out to people today is because we get to watch people like Clifford on New Wine Skin.
All right, well.
Larry, this is Lois. And
yes, Lois.
I think the pastor had a really good question there, because I live close to the state line. And so when your community is two different states, that's a good question.
It is a great question, quite frankly, and we will fund supports within the state of Oregon. That's what the funding is for. But as we've had discussion in previous trainings, we will look at regional supports. So in Washington, they may have funding and other supports in that state, and there's nothing that doesn't say that you can't call your colleagues on the other side of the border and say, what are you doing? So as people are coming over here, if people are going both ways, we need to be aware of that. But quite frankly, our services are for Oregonians that we've identified, quite frankly. But again, there's nothing that doesn't say that we can't do promotions that get information out to regional groups, even across the border.
Thank you.
And this is something that we are more than happy to actually take back to our team and discuss with our director and get more information on. And I see Belinda Brown in the chat asking maybe possibly a remedy to this is mutual aid agreement. So I've noted this and we're going to take it back to our team. And if there's any more that comes from this conversation, we'll be sure to share it with you all. But thank you for bringing up these really important points.
Thank you all for that great discussion. Truly enjoyed hearing everybody's stories and listening to everybody's feedback and questions. And thank you for just feeling comfortable to share in this group. We really appreciate it. And I think, everybody really appreciates hearing just different ideas coming from their colleagues across the state. So moving on, we'll discuss materials requests, approvals, and reporting in this segment. One thing that was brought up in some of the chat discussions were, how do I get flyers? That's what we're going to get into right now.
Josilia, before we start that, could you bring your mic a little bit closer when you speak? You sounded a little bit distant. I don't know if it's just me or if other people are also hearing that.
Oh, thank you.
Oh, okay,
I was having
perfect.
a snack. Okay. Thank
Sounds
you,
really,
Vanessa.
yeah, sure.
Okay, so any material that you find on the OHA website can be shared, of course, virtually, but it can also be printed and sent to your home. The quickest way to do that is we have an online form called a Smart Sheet link, and you'll use that to put in the information about the product that you want, the flyer that you want, in the language that you want, and the number of copies. Right now, the link is actually being optimized because we have so many different materials in so many different languages to make sure that everything is represented. When they first began having this form available, they didn't have all the materials on there. So if there is something that you would like to order very quickly, like maybe you have an event coming up, please connect with your CEC and we can work around the online form to get you the materials that you need. So anyway, you can request up to 250 copies of a certain item per order. If there is a language that you need that is not available, please let us know and we can try to help address that. It will take a little bit longer, of course, to get it translated and that sort of thing, but let us know because we are always trying to optimize, always trying to make sure that we have materials that are meeting the needs. The turnaround time is between 7 and 10 business days. And depending on how much you order and where you live in the state, that could or could not include shipping. So we can get more details about that once you do place your order. For most people, it will fall within that range of order and shipping. And we can ship to your house. We know that a lot of people aren't going into the office now, so just indicate where you want us to ship items and we can ship it directly to you. Many of you will create original content, right? So there are several different ways that this might show up. You might see an OHA flyer and lift language directly from our flyer to put onto your flyer. Do that. We love that. Please do that. That's A-okay. If you are creating anything, we just ask that you please just kind of keep the content the same. Like if it's an instruction on isolation, like keep it the same, and you could add in you can tailor it for your community, but like those heavy instructional things, we ask that you please maintain the integrity of what is being said. If you are creating something and you're like, oh my goodness, we're partnering with local public health and OHA, and we would love to just put a logo on there, that would have to go through approval. Without approval from our tribal health partners, local public health partners, or OHA, you you will need, everything needs to be co-collaborated if you're going to put a logo on there. So they'll need eyes on it. If you don't include a logo, your CEC will just need to look at it, they'll approve it, and then they'll send it back to you. If you see something with an OHA logo on it from our webpage, and for whatever reason you're like, you know what, I think the message will be received a little bit better if the OHA logo is not on the material, that is fine too. Just let us know. You don't even have to let us know. You can remove the OHA logo and share the material. Our biggest thing is that people need information, and however way they can get it is what we want to support. The last thing is the use of images. Some of the images that we have on our flyers and things are licensed and copyrighted for our use. And so we're unable to share some of those because the license is only for our organization. But there are a couple of ways around that. If you see something and you're like, oh my goodness, I really love this, I'd really love to use this image, connect with your CEC. You can use part of your startup cost to purchase anything like that, like images and different things like that to use for your materials. But I'll also share some resources in the next slide on free resources for free images and free things like that. All right. So Gloria asked a great question about adding your contact information and to OHA materials. Yes, the idea is that if you want to do that, just connect with your CEC so that we can get the Word documents of things that would be able to help you do that. And then we would just have to approve it afterward. All right, so there are a couple of free resources that you can use, and to create materials, especially like really beautiful, splashy colored different materials. So Canva and PictoChart are two free online kind of like graphic design programs for non-graphic designers. And I have used both of these, and they really make you feel like a star, honestly. I'll show you an example in just a moment of something that I've created, and I'm by no means a designer. And also for free images, we have Pexels, Unsplash, and Pixabay. These are three great resources where you can find beautiful pictures that are totally free, and use that within to do any kind of materials that you create. All right, at this time, I'll see if Vanessa can allow us to go to PictoCharts and can show you what that looks like. All right. So this is PictoChart, and this is something that I created about building social resilience. And this is something that I promise you, I was just dropping in my words, and it pretty much creates itself. And this is just an example of something. So if you were to create a flyer for COVID, and you put your logo on it, and you wanted to put the OHA or local public health logo on something like this that you've created, it would just need to go through approvals through our communications team, or through local public health. If you have a close tie with local public health, you can send it through their comms team for approval. If you don't include a logo from OHA or local public health, it would just need to go to your CEC for approval. All right. And we can head back to the show. Thank you, Vanessa.
Okay, thank you, Josilia. So now we're going to move into more guidance for materials development and media coordination. And part of the reason I wanted to share with all of you, part of the reason this particular training took a little bit longer to debut than some of the other trainings was because we had to do some extra coordination with our Oregon Health Authority communications team, or comms team, on these next few slides. And so what comms did is they've provided us with some guidance on materials used for education and outreach, and they've used this red, yellow, green light example to help guide us on what is probably the preferred and fastest method to get your materials approved if you're creating new things. So we'll start here on this slide, which is the green light, guidance for media coordination. And the green is pretty much all the tips that will give you the fastest approval of materials. So we'll go ahead and just go through this one by one. The first is use local public health authority and Oregon Health Authority developed health education and guidance materials through the CBO's own communication channels and platforms. So this will be the fastest route. If you use things that are already created and have already been vetted and have all the science and the facts already put into these materials, and you just use them in whatever ways that you do education and outreach, that is probably the most preferred and the fastest. The second tip for faster approval is use OHA language in the CBO's own materials, provided the meaning has not changed or it hasn't been taken out of context. And when you do this, when you just literally cut and paste information from one of the OHA flyers, for example, and put it into your own flyer, you don't need to do any kind of citing. So you don't need to say that it came from the Oregon Health Authority. You can just lift that language. Something else that is actually we would really appreciate and love is the CBO could correct any rumors that they're hearing. The communications team also invites you all to transcreate materials with the LPHA, emergency management, and tribal partners. So this transcreation, so it's kind of working in tandem or working alongside some of these other partners to create an original product. Also, what is advised is to collaborate with local public health authority and tribal authorities to create new or supplementary communication tools to meet community needs. So we understand that we said that we would prefer if you use things that are already made. However, we want to preface that by also saying that there may be a gap, right? Or there may be some information that is not really speaking to your communities. And so this additional material or this other information needs to be created. And so we wanted to suggest ways to do that too, in a way that it wouldn't take too much time, because we know that getting this information out fast in a timely manner is really important. So we'll move on to the yellow light now. So these are all things that they're allowed, but they might take an extra step of approval. So for the yellow light, CBOs should consult local public health authorities and CECs for any of the following activities. And we have that LPHA/CECs just because we want to make sure everybody's on the same page. So if you're talking to your CEC about this material, you also kind of want to be looping in the LPHA. And letting them know, and vice versa. If you're talking to the LPHA about this paid media event that you're doing, you also want to kind of loop in your CECs just so everybody's on the same page. So essentially all the yellow light applies to any kind of media, whether it's paid media that you as the CBO or the grantee pays for, or it's any free media about the work that you're doing. And it's not limited to, it could be more than just this, but public service announcements or PSAs, television or radio campaigns, ad placements. And so comms wants to just know about this because it's mainly to give them a heads up that it's happening. They can also, when they know it's happening, they can provide some coaching on how to talk to the media, how to answer some questions so that you also feel prepared and you don't feel kind of just thrown into this role that you may not have a lot of experience in. And so they can help coach you and give you some pointers on that. They'll also use this opportunity to explore other ways that they could expose your PSA to a wider audience so that more people can know about it and more people can hear about it, about the great work that you're doing. And finally, this last slide is red light. So these are pretty much things that are not advised. And all of these things, if you go this route, it will really halt the work that you're doing because they're not permitted. So CBOs should avoid co-branding with an LPHA, tribe, or OHA without collaboration. So just using using any kind of branding without having consulted any of the other partners, that's not advised. And I also want to say that a lot of these things are really obvious, and we know that you wouldn't do these things, but we just are reviewing them so that everybody's on the same page, and we cannot make assumptions about what people don't or do know. So this co-branding would need collaboration, review, and approval, right, from the entity you wish to co-brand with. So this shouldn't be a surprise. This material that you're developing that has the branding of these other partners should not be a surprise to them. The second bullet here says contradicting OHA or other state agency or LPHA messaging. That's something that we want to avoid. And lastly, changing any state or local health recommendations or guidance without the consultation of OHA and LPHA respectively. And so these are just more so guidance for all of you as you begin to think about the materials that you want to use to provide outreach and education. And this whole process is really, I know it may sound a little bit like, oh, great, there's yet another step, right? And the intent is not to be nitpicky with your content. We really are focusing on the logos and the branding and just the information being accurate. And all of these measures are imposed because there's a reason to them. There's a reason why we have to have multiple eyes and people knowing about what we're doing. And this work, to be honest, is really high profile, meaning that it's getting a lot of attention, and we want it to all, go well. And I think Larry actually has spoken about this in other presentations very eloquently. So I'd like to invite him to speak a little bit about why this process is necessary.
Well, that's a stretch in terms of me being eloquent. But what I will do is share what I do know. So I've been working in public health for over 30-something years. I know it's hard to think that I look like I'm been in this work for that long. But as such, I've, for the state of Oregon, reviewed materials for the HIV prevention program, and as such had to answer directly to CDC accordingly. When we review materials for COVID work, we are not looking to tailor the information in terms of what grammar or what language you're using along those lines. What we're looking for is just consistency in messaging in terms of what we're saying to people about COVID. We're making sure that it's scientifically based. We're making sure that the information is the same as you would see in OHA publications, very similar to what we would see in CDC publications, and the same with, like, for instance, other World Health Organization publications. What we don't want to see is someone sharing personal opinions, and that can easily be done. And in my time in public health, we've often had to rescue CBOs and sometimes local health departments who have published materials with this information. I'll give you an example. If you pull something from another publication, you don't have the trademark, or you're using someone else's logo, and then you put in there your own personal opinion, Joe Oregonian or Jill Oregonian picks this information up and looks at that, and it's not consistent with what they've been hearing for all these many months about COVID, then they're likely to cause a fuss. That fuss will cause ramifications within our system. What we don't want to do is to cause any ill light upon our program, because what we're trying to do is get consistent messaging out without having to spend our extra energies trying to diffuse misinformation which may occur by not getting these materials out in an even way. So what we're really talking about is just making sure these materials are reviewed very quickly. We do have processes in place that ensure that they will be reviewed. We as CECs will get your materials back out to you very quickly. Vanessa just gave you 3 options which will help you to expedite this process. But if in fact there's a value for you to put a logo on your materials, then we'll send it through our formal comms system. Even that system is an expeditious process. So we want to invite you to do that if that's a value for you. If that's not the case, then we invite you to create them, as has just been mentioned, so that we can get, again, COVID consistent messaging out to the very populations that you support.
Thank you, Larry. So I'd like to pivot this talk slightly and talk a little bit about reporting requirements, because all of the hard work and efforts to engage and provide education that you all are doing will be reflected in this through some type of reporting requirements that we have. And how we decided to do this is that this information would be collected quarterly via a smart sheet. So the smart sheet, again, as Rosilia mentioned earlier, is a link that your community engagement coordinator will send you. And so you go to that link, and that's where you will put all your information about education and outreach. This information is collected quarterly, and part of the reason that we're doing that is because we worked with some community-based organizations early on before the start of this program that helped to advise on how we engage with community and how we can do that in a way that people will want to continue to partner with OHA in the future and want to be partners with us. And what some of the community-based organizations were saying was that monthly reports were kind of like taking a long time to complete, and to do it every month was a little bit of like not the best use of time. And so they advised that we set up kind of like this quarterly reporting system. As we started to do this work, a lot of the grantees from this project are saying, you know, actually, some of us prefer monthly, and we'd like to be able to collect this information monthly and just have it ready for the quarterly. So what we've done is put together a monthly template that tells you what are the types of data that we're going to be asking about on this smart sheet. So the monthly template should, if it hasn't already, will very soon be shared with you all. It's also, if you go to the funding webpage, I believe it is uploaded there as well. And when we send out the slides, I'm more than happy to also attach it, just in case you haven't gotten it yet. You can see what it looks like. We ask you to not try to fill it out because it's just the questions. So it's not even a fillable out kind of form. It'll be kind of confusing that way, but you can use this template to know what we're going to be asking, and you can track that information whatever way you want. So if you currently track on an Excel sheet or through a software program or on an app, that is great. You can continue doing that. This form will just tell you what exactly you should be tracking. And for the community education and outreach, there are 24 questions, and I just listed some of the questions because I didn't want to overwhelm everybody and put all 24 on here, but some of the things that it'll ask is, what type of outreach did you do? Was it virtual? Was it in person? What was the number of people or the populations that you reached? What materials were shared? Like what topics? What languages were these materials in? Were there other materials needed that you felt you didn't have access to or that weren't created? What languages were also missing? There's some sections on the reporting form that ask you to rate how helpful and knowledgeable your local public health authority has been in this work, and also your CECs. And then there's there's some narrative pieces where you can share stories, and that could be as little or as detailed as you'd like. This report will be due, like I said, quarterly. So the first report will be due on 9/11. I know that's not really quarterly, like the end of September would probably more so be quarterly, but we're actually using some of this data to help inform the funding for Q2 in late September. So we want to make sure that we hear some of this information and see what needs to be adjusted, and if we need to add money to certain grantees for certain things that are missing. I also wanted to say that this monthly template, it has not only education and outreach, it has all the data that will be tracked for contact tracing and wraparound supports, and it's color-coded. So if your agency was not funded to do contact tracing, you don't have to worry about data for that section. You could just ignore it. If you are only if your agency was funded to do education and outreach, and that's it, then that's only the section that you would focus on. So I just wanted to bring that to your attention, because if you're not funded to do these other areas of work, when you look at that document, it's gonna maybe not be so clear.
So as we talked earlier, we all play a role in how we get this COVID work done. And so now we're going to talk about our communication with the local public health authority, which basically is our local health departments. So let's talk about what to expect. We want to know about what resources are being offered up by the local health department. So when we speak in terms of your concentrated work with community engagement, we want to make sure that we build a relationship with your LPHA staff who have specific oversight over community engagement coordination, okay? So that person, in effect, will help you to understand not only who that individual is, but they may also have a separate person for communications. So getting to know the community education coordinator, getting to know the communications person is going to be critical in how you organize your work, because we really need a coordination of effort across the board. If a local health department is holding an event and you're holding an event, we don't want to have them kind of bouncing off each other. We want to make sure that we're working in the most efficient model so that we can get the most bang for our buck within our communities. And so building those relationships will help us to do as much. With communications, if there are social media out there that may be speaking to your community, then there wouldn't be a need for you necessarily to recreate that, because that wouldn't be efficient. However, if you see that they're not generating materials that are specific to the populations that you serve, then that would be a good reason for you then to maybe develop some or order some that would be specific to your population. Again, in my 30-some years of working with both your types of agencies and also local health departments, I think the biggest key has been communication. The more communication there is, the more there is outcomes that you all both can live with, and the more you're all on the same page. So again, coordinate your CBO events, community-based organization events, with your LPHA. And then in addition to that, make sure that everybody in the region knows what's going on. This isn't a time to be territorial about the work that you're doing. So if other CBOs are doing other events, let's all get on the same page. We are blending our resources because ultimately we are looking at our communities at large. And though you are doing specialized work with your very communities, these are still human beings, and human beings have a means and a way of converging. So as such, let's make sure that we do likewise, okay? All right, a couple other reminders we'd like to share with you. So when we do this work, sometimes we get caught up in what we're doing and we don't really adhere to what we've been asked to do as a part of this work. And so there's times in which we have to actually go back to the contract and say, now, what am I in here this for? We're in here for COVID-related activities, because as CBOs, there may be kind of a feeling of we want to address all the social issues that are affecting these populations. In effect, we can't do that. We are asked to work within the guidelines that are identified in this contract. So if you find that you're in that gray area of not knowing exactly what that is, we invite you to work with us as your CECs, and we'll help to get you back on track. We recognize that no one strategy is going to be the same. And so we know that one size does not fit all, because if it did, we would have just given the money to local health departments. We would not be a part of this phone call right now. Phone call. See how old I am? We would not be a part of this Zoom call right now. See? And then we want you all to be creative in terms of how you're getting out there. When you were a part of your breakout sessions today, I'm sure you may have heard different methods, different ways in which people are using different platforms, different ways of maybe engaging face-to-face, using different messaging, different ideas that maybe you can bring back to your teams and say, hey, guess what? I was a part of a training event today, and there's some things that maybe we can use and utilize. Well, I invite you all to do so on a regular basis, because that type of creativity is going to help us to do a better job of getting this messaging out to the very populations we're trying to serve. Again, you know your audience well. And if you get stuck, just kind of harken back to some of the times where you were equally stuck with these populations and you found your way out of that. So recall your successes, bring them back, channel those energies, and work back into these groups with that same passion that you've done previously, because you are experts. You've done this before. Let's not overcomplicate it. Let's not overthink it. Sometimes we have the tendency to do as much. And again, we're your go-to people. We will help you as much as possible. And if you call on us, if we don't know the immediate answer, we will find that immediate answer so that you get served in the manner that you need.
So thank you everyone for your time. Thank you for being here. 2 hours is quite a long time. So thank you for hanging in there and listening to us chat away today. You've been an absolute delight. My favorite part, I think, was just being able to hear your stories through the discussion today. And we want to leave time for questions. The three of us will hang out even past the noon cutoff if you'd like to stick around and ask more questions. But we just wanted to make sure we reserve time to thank you just for being here, and thank you for the work that you do for your communities.
I did have a question. Earlier in the training, it was mentioned there's something about CBO engagement points. What is that?
CBO engagement points?
Yeah, earning points, some type of CBO engagement points. Did I mishear that or misunderstand that?
Well, I'm not sure. I don't know if you heard that correctly, or maybe I mumbled something along those lines, but maybe I said something along the lines of you'll build up kind of valuable points with your local health departments if you, again, build rapport and build those relationships with those groups. Anybody else want to weigh in? I don't remember specifically about points.
Okay, that actually makes a little more sense. I obviously misunderstood that. Sorry.
No problem.
There's no bad questions, believe me.
Okay.
Trust me, my team will tell you I ask a lot of crazy questions. I should say our team. I should say our team. It's not my team. I'm but a peon.
If you feel more comfortable putting questions in the chat box, feel free. We'll be collecting all of these questions as well as the questions from the previous trainings and putting them online because you guys asked really good questions. So feel free to use the chat box, raise your hand, wave your hand. We'll
Cecilia, there was one question I think I'm not sure if anybody got to it in the chat earlier on about large print and Braille.
Yeah.
Like, was that answered, or do we want to go over that? Is that available when people or when grantees order forms? Are forms or documents, materials, are those materials available in large print and Braille?
They are. So it would just be indicating that you need those resources on the order form, or since the order form is still kind of being optimized right now, if you need those materials, just let your CEC know. On the bottom of all of the OHA flyers, there is we call it an OHA number. So you'll see OHA and then you'll see a number right beside it. That is really helpful in tracking what materials you want. You can also send the link of the flyer to your CEC if you need that kind of material in the absence of the smart sheet form. So yes, that we can make that happen.
This is Lois. Can you hear me?
Yes.
Yes, Larry, I just wanted to, it's kind of a statement, it's not a question, but what I learned in our breakout session was, and that was I thought also that it's important to think outside the box, to get the needs out, to get them met. And it's always, and that's one thing that because I live in a rural area and I live in Umatilla. And so we had the flooding. And then right after that flooding, we had COVID-19. So we were still trying to recoup from the flooding, and the COVID-19 came in, and it's so important to think outside the box and see how those needs can be met, I think. And our needs here in the rural area are different than the metro. So I worry about, I live in a 55 and older community, and not everybody has internet. So it's important to think outside the box, and I worry about those people getting their needs met.
You bring up very good points, and I think that, you know, with the onset of COVID, you know, some of the resources that people had access to, like for instance, sometimes people went to their local libraries for internet, or they had other community centers where they would have access. And so,
right, and those centers are closed.
Exactly. So you bring up some very good points, and you know, I kind of know the region a little well. I went to junior college for a short time in Walla Walla, so I know.
That's where I went too, Larry. I went to the same college.
So yeah, I played for the Walla Walla Warriors way back in the day. So
oh my
anyway,
gosh, what day?
I won't say, I'll embarrass myself, but we were rated 6th in the nation when I played, and I was on the starter on the freshman team. Anyway, back to real life. I will say that the issues that you bring up are right in terms of thinking outside the box. I think that's why these funds are going out to CBOs. That in its own right is why we're thinking outside the box. And I think those adaptations, when you do as such, I would say work with your local CEC to see exactly what you're trying to do in order to accommodate your populations.
Absolutely.
What I've seen thus far is when people bring up questions or bring up proposals, I found that Dolly, who is our manager, has been very accommodating in terms of reshaping and tailoring services to accommodate. So I would truly encourage, and we would as CECs encourage you to continue to do so.
Right, I'm on the I'm on the DMAC team. So we're thinking along preparedness, you know, for those emergencies. So it's the same with the COVID. I mean, it's an emergency, it's a pandemic.
Well, I appreciate you bringing up some of the points that you have, because again, there are subpopulation groups of all the groups we're working with who are still cut off from some of the things that we're participating in today because of some of the technology that we have available to us that they don't necessarily have.
Absolutely. They're isolated and they're frail, and they can't get out. I right in my community, I know of a few.
So when thinking outside the box, there may be a conversation for short-term disposable phones, things along those lines. I'm not quite sure. Maybe those are discussions to be had.
Good idea.
Hey, Larry, as far as thinking outside the box, I want to just share a little bit, not just on my behalf, but on behalf of people who I believe that they share the same situation. I was working for Multnomah University as a custodian, and I resigned last year, October, and I took 3-month vacation in Hawaii. Upon returning, the type of work I do was in hiring because of COVID-19. And so, like all the way to this day, like yesterday during the wraparound training, they made sure that the system was only for people who are isolating because, being COVID-19, and for people who are quarantined for being contacted with a case. And so anyway, like I'm not even eligible for unemployment because I resigned, and I'm not eligible for any of the COVID assistance because I never was infected. But yet I cannot find job because of COVID-19. And just recently I was hired at Utopia, but that doesn't mean that the big hole that I left has patched up already. It's still, I'm still behind on stuff. So, speaking of outside the box, I just wanted to bring this in because I know, there's a lot of great need out there that with people who never got infected with COVID-19, but yet it's hard to find a job because no one is hiring during COVID-19. So that kind of situation, I just wanted to bring it up.
Absolutely, Roger. I have a client who she's kind of similar, and I'm helping her with her disability claim for Social Security, but in the meantime, she has a family and she has no income. So there are immediate resources to help them if their lives have been disrupted by COVID-19.
Thank you.
And I'm sorry. The wraparound training should have also gone over kind of the safety net resources. So that's like a whole other area for people, like as you were talking about, Roger, that have not been infected or are not a contact with somebody who has a positive COVID test, but who still need these valuable resources to pretty much make ends meet and continue to pay bills and rent and put food on their table. And so those wraparound services are more so geared towards that population and those folks. So that should have also been something that was covered in the training. And if we need more clarification on that, that's something else we can take back to our team and share with you at a later point.
Awesome, thank
you.
you.
Yes, it was covered, but I wanted to bring up that scenario of, because I understand that it's, like I said, I'm not, even though it's me, but I don't want to talk on my behalf. I want to talk on behalf of people who are experiencing what I'm experiencing.
Yes.
Outside the box.
Thank you.
I would just want to respond to that, Roger. It's an incredibly difficult situation that you speak to. And then in doing this work that we've asked you all to do, there's going to be challenges in that we, as I said during our presentation, it's going to be tough making that decision between serving the needs of persons who have been impacted by COVID or who are at risk or may be exposed, and then wanting to take some of this funding and address individuals like you've just described. And we have to, again, work within the guidelines of how this funding has been suggested. And that's not going to be easy. And it's difficult because we see there's money being afforded, but then again, we recognize it's not available for those who are in such desperate need. And so I don't know how to deal with that, other than to say that it's an acknowledged deficit that's in the community that's gonna have to be dealt with. So I challenged those who are left on the line to maybe share a question about maybe something they want answered as they were leading up to this training that maybe wasn't answered or maybe not in the way that maybe they wanted, so that you can get something in addition to what's already been shared that you can take back with you. What we would hate to see is that you came to this training with one goal of getting something answered and that never took place. So we invite you to share your question with us. This is the time to do so. Not only do you have the CECs here, but you have your esteemed and knowledgeable other CBO colleagues here. So please ask the question.
I do have a question, and I mean, Vanessa, you've been wonderful. I don't know if Jamila is with us, Klamath County. I'm Belinda Brown with Lomacazzi Restoration Project, and this is not our normal arena of work. However, we have the relationship with the Latinx and the tribal populations, and it's why we've put our hat in the ring, so to speak. And what we're seeing is, like a lot of programs, is identification and referral. We're going out and rounding up warm bodies who need help and assistance, and that wraparound services. That funding is separate from this funding. And so the upfront costs of this public health crisis is something that our CBO is having a hard time front loading in regards to the referrals that we're getting. So the need is more than the funding that we have to address that need. And that's where we're at right now. And the messaging, what we're finding out in Jackson County, 42% of our population is Latinx, and that's 13% of the population, is that we are not providing the effective messaging the way that we need to. And there's so much fear out there with both of these populations, whether they're going to be deported or in our tribal population, that the government's giving them COVID by the testing sites. So those are the two huge barriers that we're overcoming. We're good-heartedly, good faith, trying to do what we need to do. It's just the mandate, like many federal and state mandates, came down without the program development money to implement this program in an efficient and responsible manner.
Larry and Josilia, I spoke with Belinda about this yesterday, and I said that I would take some of this feedback back to Kara, but I don't know if there's anything else that either of you would like to add.
You know, at first hit, I would just, you know, first and foremost, I would think engagement with some of the individuals from, you know, from these communities as a first measure in terms of maybe finding a safe place to be able to have that dialogue in terms of where people would really speak to some of the gaps that you're seeing. So how could you get messaging where they would be able to promote, where they would be able to further the work that we're doing in a manner that would accomplish what we're setting out to do. And so with all the obstacles that are out there, the ones that you've already stated, and the some that of which, you know, inherently have been caused by some of the constructs that we see in government and in society, how do we overcome those? And so working with some of your popular opinion leaders, working with some of the communities that really provide services with them, both locally and regionally, maybe finding stakeholders or programs even where you find individual champions who really have entrusted relationships and can really forge maybe some discussions about how you take that next step forward. Might be one recommendation for how you continue forward.
Yeah, thank you for that. We've got it in the community. We just don't have the wraparound services. I'm understanding that's a separate pot of money to be able to provide when a person is quarantined. Like if we have an elder quarantine right now, we can go out and do that, but it's all on our CBO to provide the rent, the medications and all that until we can get an invoice and get that money back. So the wraparound services pot of money, separate from what we're mandated to do, is a barrier within the state system right now. And just to let you know, in Native American and Indian country, where we're seeing is just like the churches, like the Native American church, we just had to do an outreach to a Native American church ceremony where 20 plus people are in a teepee all night long for 12 hours. And these type of ceremonies are another challenge of our faith is bigger than the virus. Mm-hmm. And so that's another thing. We had somebody over there taking temperatures, trying to get them to mask up, trying to get them to cancel the ceremony. And this is what we're up against. And I would venture to assume that in Navajo country and back in the Lakotas, that's what we're up against, is these ceremonies that people are coming together still and gathering in these places, and we're seeing outbreaks. And there's already an outbreak in Klamath County, and we're not able to put a cap on it due to, and we're not able to get to the people right now that are quarantined because we don't have these MOUs and the funding and all of this in place in a really streamlined manner.
So I do know that there's a tribal affiliation, and you know it too in Klamath, and so I'm wondering if you outreach to that group and maybe ask what they are doing specifically, or maybe they're uh, yeah, what they're currently doing with respect to COVID currently. I imagine that there are some activities they're involved with, and so maybe we talk offline, and maybe I talk with Jamila, and we all put our heads together in terms of maybe the next step of what we can do collectively, along with engagement with the local health department, to see, using a team approach, how we can address this issue, because that's an issue, that's a concern. And again, we do not want to support systems that are going to allow for the further transmission of COVID. So maybe offline discussion about that.
Thank you very
Belinda,
much.
thank you for sharing. I think it's helpful when you share your experiences, because you're right. Like in the faith community, like, you know, this is huge. Like being able to gather together, being able to celebrate together and celebrate each other, and so there's a huge kind of like push-pull here, conflict, where you know there are ways that people can gather safely. But if people are unwilling to take those measures to protect themselves and to protect each other, that's when, you know, we have to really like show and express, you know, sickness happens very fast, and in a closed space like that, it can definitely happen, and it can ravage a community. So yes, we understand your challenge, and sometimes it's like talking to that one key informant in the community, somebody that you know has influence, that can talk to others and say, hey, this is why we need to be distance, this is why we need to modify, like we're in a new world now, and there has to be a way that we can preserve culture while still staying safe, and trying to tailor that messaging in that way that you know, just because things are different doesn't mean that we have to lose everything that makes us, our culture, unique. We just have to try to pair it with safety measures to make sure that we are protecting our community, and that our community stays strong and our community stays safe. So that's going to be part of the creativity and part of the reason why, again, like this grant exists, so that you have that room to kind of cultivate that that conversation, and cultivate that, and remind people that, you know, if we're all getting sick, you know, we can't do these things that link us together as a culture and as a people. So thank you for sharing.
There was a question earlier, if I can transition us, about from Melanie. Is Melanie still on the line or on the call or on the Zoom, whatever we're doing?
Yes, I am.
Yes. So you had a couple of questions. One first about the spending. You said we are spending a lot of hours preparing and readying for outreach, trying to understand what the needs are. Is that considered accounted for in the reporting? And I responded in the chat, but I wanted to make sure I bring it out and just share it with everybody. There is a question on the reporting form that says, what challenges, and it's number 7, if you need to go back and reference the form, or if you have it in front of you, what challenges did you experience in conducting community engagement and outreach? Staff capacity, ? Ramping up / sustainability, ? So I would assume that that's a place that you could add that piece. Of the time that you're finding that it's taking you all to prepare for that outreach, that would be a place that you could get that information in there. Is that, did that answer your question? Or?
Yeah, that's helpful. Thank you.
And you had a second question. Do you want to, I invited you to say a little bit more about that. Could you ask your question and then just tell us a little bit about what you'd like to see on the funding webpage?
Yeah, so part of what's been really helpful with these webinars for me is just hearing from other people, and especially in the small groups, hearing how other people are doing the work. And I don't know if there would be a way to add maybe a category on to that table that's on the main funding page that explains how people are doing each section of the work or what they're doing. I don't know how that would be able, we'd be able to keep it brief though. Or like, you know, yeah, I don't know how you'd be able to categorize that, but.
Yeah. Oh, that's definitely something that we will continue to think on. I was also, as you were talking, the meetings that the CECs will eventually begin to coordinate with all the community-based organizations in the particular region, and the LPHA might be a space for that. And it may even be a separate space where the CBOs of a region want just alone time with the CEC or with each other, with other grantees to hear about some of this work. So if that's of interest to you, I would encourage you to bring that up to your CEC to think about how they can make that a possibility or create more opportunities to share how you all are doing the work. But thank you for bringing that up. I think that's a really important point. And that's really why we wanted to do the breakout groups today, so that you all can begin to get a taste of that, of what other folks are doing, and get some ideas and some approaches for the work.
I want to reflect on thanking Isabel Jordan for bringing that subject up, and also thank Josilia Johnson for her response, because this is like an area is really big to me, because um, Isabel was just talking about ritual, but this same situation deals with cultural and religion and all kinds of belief. So I just wanted to say thank you for that, because I think that's something big, because we're trying to stop the we want to you know try to stop the spread of COVID, and those are really happening, and those are the real answers that Johnson uh, gave, and to find the connection. I just wanted to say thank you.
Thank you for your words, Roger. Yeah, it's all interconnected, right? And we can't, the moment we start to leave off culture and faith and these things that tie people together, especially during times of trauma and uncertainties, is we're missing the mark. Like these are things that people lean on in times of trouble. The people that they know, the culture, the things that ground them. So yeah, I feel like it's a big piece of the puzzle, and being able to recognize that and not forget about it, and also honor that while staying safe and preventing disease is so important.
Are there other questions that people had? You all are a dedicated bunch. It's 20 past noon and you're still here. Let us know if there's something that we could help you with or that you want us to talk more about.
Going once, going twice, I'm just playing.
Again, if you think of any questions, as soon as we log off today, reach out to your CEC. They'll be able to steer you in the right direction.
And we really appreciate all the sharing that you all contributed throughout the presentation. As we said at the beginning of this training, we learned as much as you did, and that's what we love to take out back to our CEC team, our community engagement team, so that we can grow, learn, and adapt to what's going on in the community. So group, since we seem to be staring at one another, I think we're gonna officially call it a wrap. And so I'll let our beautiful co-host sign us out.
I want to make sure I download all the questions in the chat before I do that. So just allow me 1 second here. All right.